Talking with Dr. John Zink. Doctor, can you talk about a problem that I think affects almost everybody in this country at some level, and that's obesity?
Yes, you're right. It's a very serious problem in this country, and it's estimated that about 2/3 of Americans are overweight. About 30% of that number are folks that are classified as actually obese, which is a body mass index greater than 30. Now, the reason it's a problem is that it's not just cosmetic, but these people can't move around like they should. They can't do their activities of daily living like they used to. And then most of all, it's a major, major risk factor for diseases like high blood pressure, high cholesterol, diabetes, even osteoarthritis. That weight puts a lot of extra pain on those joints. Mm-hmm. So as a disease, obesity is responsible for a lot of deaths in the United States. It's estimated to be about 400,000 deaths per year.
And it's an epidemic that, you touched on it a little bit, but leads to so many other problems too. And that's, I mean, if we could get rid of the root cause, we'd all be a little bit better off.
We would. When I was in practice, a lot of my overweight patients clearly had more problems than the ones that had a normal weight. Mm-hmm. And they were actually at risk for things like cardiac disease that got them into a lot of trouble.
Mm-hmm. So we all try to lose weight. There's billions of products out there, different ways, different diets. Every year there's new ones out there. How do you lose weight? I mean, that's the $64 million question.
Scientifically, from my standpoint, it's a pretty simple problem. Obesity you can think of as sort of a energy imbalance, and that occurs when energy expenditure is way out of equilibrium with energy intake, which is basically food intake. So in order to lose weight, the equation gets rather simple. We basically have to create a negative energy balance, which means that we have to affect either food intake, drop that number, or increase energy expenditure. Now, most weight loss programs today put a major emphasis on diet and decreasing energy intake. And increasing energy expenditure, or increasing the amount of calories that you burn, is not so much focused on, except in diet programs that have a big exercise component. So what we're going to talk about today is something that can actually, what we call pharmacologically, increase energy expenditure. So other than just exercising all the time, there may be something, a supplement actually you could take that would actually increase your resting metabolic rate.
Bottom line is, though, there's no magic bullet. That you got to put the work in. You have to educate yourself and do it the right way.
You really do. There absolutely are no magic bullets. I mean, if you're not adhering to that equation, if you're not doing something to make sure you burn more calories than you take in, you simply are not going to burn stored fat.